Hey guys, this is Dr Lazaris here. Welcome to my YouTube channel. Today I'm going to be talking to you guys about smile design. The first stage with any sort of aesthetic design is to actually talk to the patient and find out exactly what it is that they want to change, what they don't like about their teeth and how they'd like the finished result to be.
Well, I am happy with my teeth, but there's a few things that I want to improve, like the gaps in my teeth, and I just want to have a better smile and be more confident with my smile.
So after talking at length with Shani about the things she didn't like about her teeth and how she wanted them to look, the next stage was to gather all the information that we needed, which included a whole lot of photographs, impressions, x-rays, etc., so that I can go through the process of designing her smile for her. One of the key processes happens outside of the mouth, where we go through a process of designing a smile digitally on computer using sophisticated software, and then that gets transferred to a 3D smile design that we can actually trial in on the patient and make sure that we're on the right track before we even get started. This process of smile designing and creating these individual mock-ups for the patients is a process that's generally omitted in a lot of aesthetic cases, or it may be farmed out or delegated to an off-site laboratory. So an important issue for me is to take control of the case from beginning to end. That's why I insist on doing all the smile design procedures myself, including the analysis and creating the wax-ups. And I think that's a key element of success in any sort of case that we do here. And by the time we actually finish the case for the patient and they get to see their new teeth for the first time, there's no horrible surprises, there's no disappointment. And that's how we get success, through predictability in design. So in Shani's particular case, her concerns were the gaps between her teeth, and her teeth were a little bit worn down. They weren't quite full or as large as she would like them to be. Having gone through the process of taking her records and analysing the appearance of her teeth and her smile, I then went through the process of actually creating a new smile using composite resin veneers. Composite resin veneers are an effective and conservative way of changing the appearance of teeth by adding a plastic type of resin material to them, which is moulded freehand on the teeth and then set by a bright blue light that makes them very hard. One of the key elements of this procedure is to actually make the smile fit the individual. So taking note of the patient's character and how they are, whether they're vivacious or whether more reserved, personality traits all play a role in the way that we design the teeth and the smile. Natural teeth have undulations and different characteristics in them. So adding these little characteristics and anatomical details to them is key in making the finished case appear natural and look like it belongs to the patient and belongs to the individual who's wearing them. The most important thing is to not look like you've had your teeth done, but to make it look like you've got beautiful natural teeth.
So we've just spent this appointment making some composite veneers for Shani. We've changed the size and the shape of her teeth to give her a more attractive smile, close some gaps, and something more appropriate to her age and her face. The procedure was all done in a couple of hours, or in one step. So now we get to show Shani what we've done. Ready?
I'm so nervous.
Yeah, I'm more nervous than you, but I reckon you'll be fine. Come on.
I'm scared to look.
Don't be scared.
Oh my god. Oh my god, I love them.
Thank God for that, I thought.
So I'll try to come up with some more videos for you shortly. If you have any questions, comment below, and don't forget to subscribe. So how do I look? What do you think?
Fabulous. Really nice. I'm going to leave and take like 1,000 selfies.
Yeah, you do that.
And upload them
Right,
all.
please. Tag me.
No, really good. Sparkling light.
Okay, good.